In this presentation, I am going to talk about muscles of mastication. The muscles of mastication are essential for the intricate movements of the jaw, facilitating the manipulation of the mandible at the temporomandibular joint. The varied activity across muscular planes during masticatory functions underscores the importance of recognizing and respecting the anatomical and functional individuality in diagnosing and treating dysfunctional disorders of the masticatory apparatus. There are four main muscles of mastication, which include 1. Masseter, 2. Temporalis, 3. Medial pterygoid or internal pterygoid, 4. Lateral pterygoid or external pterygoid. Accessory muscles of mastication include 1. Buccinator, 2. Digastric, 3. Mylohyoid, 4. Geniohyoid. As I said in the previous slide, there are four primary muscles involved in mastication: the masseter, temporalis, lateral pterygoid, and medial pterygoid. Masseter muscle is a paired, strong, thick, and quadrangular muscle. It originates from the zygomatic bone's maxillary process and the temporal bone's zygomatic arch. Both parts extend down to the mandibular angle. The primary function of the Masseter muscle involves the elevation of the mandible, contributing to the closing of the mouth. Additionally, it plays a role in the protraction of the mandible, facilitated by superficial fibers, and the retraction of the mandible, controlled by deep fibers. The Masseter muscle is innervated by the mandibular nerve. The blood supply is primarily from the masseteric artery, which is a branch of the internal maxillary artery. In this slide, the human Masseter muscle can be seen. The temporalis muscle is fan-shaped and bipinnate. The temporalis covers a significant portion of the temporal bone and lesser sections of the frontal and parietal bones. It inserts into the mandible's coronoid process and the mandibular ramus's anterior border. The temporalis muscle originates from the temporal fossa of the skull and inserts into the coronoid process of the mandible. The deep temporal branches of the mandibular nerve innervate the temporal muscle. Action of the temporal muscle includes elevation of the mandible. The posterior fibers primarily facilitate the retraction of the mandible. The main function of the temporalis muscle is to move the mandible or lower jaw. Specifically, the temporalis muscle elevates the lower jaw in order to bite or close the jaws. It also functions to retract the lower jaw as well as move the lower jaw from side to side. The fascia that covers the muscle can be surgically harvested for specialized procedures like myringoplasty. The temporalis muscle consists of three parts: 1. Superficial, 2. Zygomatic, 3. Deep portion. Here, superficial parts can be seen. You can see the zygomatic part. In this slide, deep portions are visible. Superficial, zygomatic, and deep portion parts can be seen in this slide. Medial pterygoid or internal pterygoid is a quadrilateral muscle. The medial pterygoid muscle consists of two heads. The smaller superficial head originates mainly from the maxillary tuberosity, with some fibers arising from the pyramidal process of the palatine bone. The larger deep head originates from the medial side of a horseshoe-shaped extension of the sphenoid bone, lateral pterygoid plate, at the base of the skull. Insertion. The muscle inserts into the medial surface of the ramus of the mandible, below and behind the mandibular foramen and mylohyoid groove. Medial pterygoid or internal pterygoid nerve supply arises from the trunk of the mandibular nerve. The medial pterygoid muscle has functions including elevating the mandible, closing the mouth, protruding the mandible, mastication, especially for when the maxillary teeth and the mandibular teeth are close together, and excursing the mandible contralateral excursion occurs with unilateral contraction. In this slide, you can see the medial or internal pterygoid muscle. Lateral pterygoid or external pterygoid is the key muscle of the infratemporal region. Lateral pterygoid rises by two heads, the upper head and lower head. The superior head of the lateral pterygoid originates from the greater wing of the sphenoid bone, which is a bony protrusion located on the sphenoid bone. The inferior head of the lateral pterygoid originates from the lateral surface of the lateral pterygoid plate. Nerve supply of lateral pterygoid arises from a branch of the anterior division of the mandibular nerve. The primary function of the lateral pterygoid muscle is to pull the head of the condyle out of the mandibular fossa along the articular eminence to protrude the mandible. A concerted effort of the lateral pterygoid muscles helps in lowering the mandible and opening the jaw. The lateral pterygoid muscle is visible here. The lateral pterygoid muscle is visible in this image. You can see lateral and medial pterygoid muscles in this slide.